where we explore the secrets of smart lifestyle choices, sexual health, and the science of self-care. With leading medical experts guiding the conversation, we're here to educate, empower, and ignite your curiosity. Because your body and soul deserve the best. Late night just got a whole lot hotter and healthier. Body and soul, because you deserve to feel good inside and outside. Thursdays, 10 p.m. on Tonight with Somi.
Thank you for staying with us on 95.1 Nigeria Info. We are all set and ready to get into the conversations around body and soul. And tonight we are starting off on sexual dysfunction. We're going to be dealing with sexual dysfunction here on the show. Remember last week we introduced the show and said we were going to get into, for the first phase of the show, or rather for the first series of the show, we said we're going to get into with sexual health and sexual and reproductive health. And so we are starting tonight. And I am thrilled to have with me here on the show, though virtually, Dr. Magnus Felix, a consultant urologist at Shiva Specialist Hospital and Urology Center Limited, Abuja. And it is really good to have you here, sir. Good evening and welcome.
Good evening. Thank you for having me. I'm also happy to be on the show.
Thank you for being here, sir. We really appreciate it. All right, people, we are streaming live on Facebook and YouTube. You want to go to Nigeria Info Abuja to get in on the conversation. And you see that we are starting with something that is very, very important and is very, very key. I mean, I would like to say I can give some statistics and some information as to some of these things. So I'll just give a little bit of what I have, and then when Dr. Felix starts the conversation, he will give you even more. Remember, there was Dawn who spoke sometime in 2017 and was talking about the fact that sexual dysfunction in males and females are very high in this part of the world, right? Now, there is that conversation that prevalence of sexual dysfunction for men is between 20 and 30% and 40 to 45% for women. And so, you know, these figures, they look really, really high. And I'm like, okay, what is this to start with? I'm going to allow Doctor do his thing. We're going to start understanding what exactly is sexual dysfunction, and then we will get to, I'm supposed to start with the myth and fact. Maybe I'll do that, and I will allow that to drive us into conversation what is and what isn't sexual dysfunction. So, Dr. Felix, help us demystify, if there is any way to do this, or if it's a fact, you help us state that it's a fact. Some people say that as you grow older, you lose your sex drive. Is this a myth or is it a fact? And can we link this to dysfunction? What exactly is this? Let's just get you jumping on it.
Thank you very much. Yes. The older someone gets, the more the sex drive declines.
Okay.
It's said that these are because of some obvious physiological changes, what we call changes in the bodily function that happens as someone grows old. For instance, for men from the age of 40, the male hormone, which we call testosterone, begins to decline, over time, gradually, such that, the same sex drive you used to have when you were a younger person is no longer as it should. In fact, that for men, their peak sexual activities are usually between the age of 18 to 25 years, while for female, from the age of 30 to maybe around the early 40s. So it tells you that, beyond these ages, the chances are you can't really have, all of your sexual prowess the same way it used to be because of the obvious changes that happens with age. So it's a fact.
It's a fact. Okay. But so that thing that they say about older men being active in bed and being able to deliver on the goods, that's also a myth. I mean, going by what you just said, because there's this thing about older men, the silver foxes. They say, no, you can't go wrong with them. So by what you're saying, that is just what they say to get the ladies in bed, is it?
Well, from what we just said about, the declining level of sexual function as one ages, it tells you that older men cannot be
as viral,
powerful as the younger one. Yes, they can't be
Okay.
as viral as the younger ones. Why do I say this? In fact, it's a common thing that you hear that an old man goes to bed with a younger lady and develops stroke. These things happen. So it tells you that if he should be that powerful, then he shouldn't have stroke. That is also why, if for those who understand, the Bible sometimes, the Bible talks about you loving the wife of your youth. It just tells you that yes, there's this something that has to do with, someone who was young when you were young, and as you're growing older, the person is also growing older.
Okay.
But if you do the reverse, where you go and take someone who is far younger than you are, then you're in for a big work that can even be too much for your heart to handle.
Okay.
So it's actually a fact that, or rather a myth, that older men are good in bed. They can't be as good. They may have some experience, but that doesn't mean they're as good.
As when they were younger, comparatively
Yes.
speaking. Okay. So
Comparatively, yes.
So does that denote dysfunction? Because we're trying to use this to define what sexual function is. I'm just going to give you what I see here as a definition, and then you go ahead and educate us before we get into the meat of the matter. It says sexual dysfunction occurs when you have a problem that prevents you from wanting or enjoying sexual activity. It's different from asexuality. People who are asexual don't have anything to do with sex at all. It's not in their bodies, not in their system, nothing. But for people who are experiencing a dysfunction, it's said to happen when they find that there's something that is preventing them from wanting or enjoying sexual activity. And this definition says it can happen anytime, whether you're young, whether you're old. It said people of all ages experience this sexual dysfunction, although the chances increase as you age. So that part about the myth or fact, you've cleared that up. So is this a definition? And you know how we like to do on Body and Soul is we keep it as layman as possible. I don't know if that's the right word to use, but as relatable as possible. So is this a proper definition? If you were to expand on this, could you please do that and let's understand what it is, and then we'll get into the causes and then how to deal with it.
Okay, well, you already said it. It's not so different from what I'll say, but just to put some light, yes, sexual dysfunction has to do with any problem occurring in any of the phases of the sexual response cycle. Don't worry, I'm going to come down a little, just trying to give you the show.
Okay.
Any problem occurring in any phase of the sexual response cycle prevents an individual from having a pleasurable sexual experience. So it means that anything ranging from things that may be a disease process or things that may be psychological, things that may be from desire problems, like a person doesn't have as much desire or interest in sex, to things that have the ability to participate in this either due to pain. And that is why when we talk about the sexual response cycles, sexual response cycle has to do with the phases that has been described that humans or those who engage in activity go through. We have there is 4-stage model that we use for convenience of description, teaching, and education. Usually said that first there's this excitement phase where desires to engage in sexual activity. Most people describe that as libido, meaning that you have this desire for sex. So usually in that process, that is also where for a man, the man may begin to have erection. And this can be activated through several processes, visual or audio signals, meaning that maybe just seeing somebody desire and be aroused in you, just hearing the voice of somebody, it can actually make you feel like, oh, I think something can happen between us, also ranging to touching or actual contact with these people. So that excitement phase is actually the first phase. And for men, it's you have erection. For female, usually they may begin to have some also erection, what we call the erectile organ in the female. It's called the clitoris. So some of them can have some engorgement of the clitoris at that time, maybe some increase in vaginal discharge. Something may see the woman be a little uncomfortable, maybe crossing the legs and all kinds of things, or becoming violent. But those are all forms of excitement.
Okay.
Then beyond that, you now be to talk about the place where the person becomes aroused. Aroused. Oh, well, the time beyond the arousal is the fact that when the man has been excited, for instance, and has an erection, the tendency that the man wants to engage in sexual activity comes. And in the process of engaging sexuality, they will really have some pleasure experience if the person is normal. And that phase, we call it the plateau phase.
If the person is normal, what is that? What is that?
Well, the person doesn't have any problem. Because we're going to also discuss the problem of focus. I'm going to buy some persons, the problems are the fact they don't have desire. Some people, when they don't have arousal. Some people have arousal. They're not able to even have, what we call orgasms. Meaning that even after engaging in the activity, they're not able to go to that phase where, their genital expresses that intense pleasure, that they felt, so to say. Yes, that's what we're saying. So we're going to describe these different phases, but I'm just trying to tell you the sexual response cycle, which is a 4-model stage. The excitement phase, then the plateau phase, then the orgasmic phase, and the resolution phase. The excitement phase is what we just talked about, erection in a man, desire. The woman will also have some form of erection, as well as, increased vaginal secretion. Then beyond that, the person engages in sexual activity. There's intense pleasure, which usually for most persons, they will experience some increase in their heart rates, in which case they will become aware of their heartbeats. Yeah. They will start breathing harder. Some of them, their eyes will become wider, and all kinds of, noise and all kinds of things can actually happen at that phase. And that is the phase that is just before, orgasms. Okay. So an orgasm, what is orgasm? Orgasm is the genital expression of that intense feeling that comes from pleasure. In which case most persons, especially for men, will have ejaculation at that phase. Meaning that when they are so excited, one of the manifestations of orgasm is that they will have ejaculation at that point. Yes, for men. Okay. While for they will have a lot of contraction of the muscles around the genitals and all forms of pleasurable feeling. That's orgasms. After which the resolution phase comes, in which case for the man the erection will begin to come down, and for the woman she no longer wants to continue in this act of sexual activity because she feels satisfied. So these are the sexual response cycle, what we call the 4-stage model. Yes, and the disorder, what we call the dysfunctions, what we call sexual dysfunction, actually arises from anything that stops any of these phases from happening the way I've described it. Yeah. And that is why, maybe briefly, let me just categorize the various disorders that make up sexual dysfunction. It has to do with when we talk about the various forms of disorder that characterizes sexual dysfunction, it has to do with a disorder in desire. Meaning that this person doesn't have desire. The person doesn't just feel like engaging in sexual activity. Doesn't feel like being intimate with anyone. Some people will tell you that I don't just feel like doing anything. I just don't know if I'm normal. Some of them maybe because of the fact, just like we said, their testosterone is low. We already mentioned that the male hormone begins to decline with age. So if the testosterone is very low, it may affect the desire of that man. Okay. Yes. Then beyond that is the fact that you also have arousal disorder, in which case the person may have desire but is not aroused. So that the person has desire but is not able to have erection in the man, or for the woman, it's not able to be excited such that there will be increase in secretions in the vagina. These are the things that we call arousal disorder. And that can really be very, very distressing. And sometimes this arousal disorder may not necessarily be because, the person has low hormones, what the testosterone in the man. It may also be due to the fact that the physical structure not even. For instance, a man that maybe it's either due to an accident has amputated penis, you can't have erection. So clearly, yes, you desire, you're excited, but you can't be aroused. You can't actually achieve erection. So beyond that is the fact that persons, after achieving erection, may have a disorder in orgasms. They never get to that point where they feel satisfied and they feel like, wow, this is so pleasurable, and they are satisfied. Just like I say, for the man, they ejaculate. For the woman, usually they have these multiple, movements of the muscles around their genitals for the woman. So these are all the things. Then also the resolution phase, where some persons, stay so long, they're not able to achieve orgasms, and even when they achieve orgasms, they're not able to really, achieve what we call flaccidity, meaning that the penis for the man doesn't come down immediately. It takes a while, for that to happen. So these are all forms of sexual dysfunction. But specifically, we have different types in a man and a woman.
That's the types of the dysfunction, yes?
Yes.
Okay.
There are different specific ones that we can discuss for men and for women. Okay?
Yes.
For a man, form of, erection, erectile dysfunction. That they can't just have an erection. Despite the fact they have desire, they feel like they need to do all forms of, they want to engage in this intimacy.
Yeah.
But the erection is not just coming to, erection, they don't have erection to actually express desire. That's what we call high function or weak erection. Then sometimes when they have this, and they penetrate, they may begin to have pain around the penis. What we call penetration pain during sexual intercourse. It's a form of disorder which most men can actually experience sometimes. Then also for some men, when they achieve penetration, they can have what we call quick ejaculation, also known as premature ejaculation. Meaning that even before they get to point found, they're already ejaculating, they're already semen or sperm into their spouse or their partner, as the case may be. And that may be so dissatisfactory because they haven't really gotten to that point of intense pleasure. So that is also a form of sexual dysfunction that men can experience. Then beyond that is the fact that, for females, they have problems with, low sexual desire. They can also have problem with, pain during penetration.
Okay.
Meaning that because of that, they even try to avoid any form of intimacy because they know that if they try to do anything, they're going to have some pain. Usually call this dyspareunia. The pain is beyond the genitals, or what we call the lower third of the vagina. We call it dyspareunia, pain during penetration. Some patients may have what we call vaginismus, which is just pain around the vagina. In which case the vagina will be so tightened and so narrow that penetration is difficult. And because of that anticipated pain, they tend to avoid any form of penetration. So that's also a form of disorder that females can experience. They must never have orgasms. If that's a very common thing because said that some females may never have an orgasm.
Very common, you say?
Yeah, very common. Yes, a lot of females have orgasms during sex,
and it's a dysfunction.
Yes, well, for females we can't say it's a dysfunction per se. Because sometimes it's the fact that the man is not able to stimulate them enough to that point where they have orgasms. Yeah, so it's not necessarily a clear dysfunction in a female, just like it is for a man. Because a lot of females, orgasms in females are a little different and a little more complex compared to that of a man. So these are some of the things that constitute sexual dysfunction.
All right.
And whenever it happens, it can be so distressing and make sexual activity non-pleasurable for anybody involved.
Definitely. All right, Dr. Felix, you've been speaking extensively, just trying to get us to understand what a definition is. We need to go on a quick commercial break. When we come back, we're going to delve a little deeper into some of this information you've given. I'm very particular about the things that cause these dysfunctions, but we'll have that after this time out. Do stay with us.
Your number one talk, news, and sports station. This is Nigeria Info.
World Fielded Option.
And we're taking on what some would describe as a very, very sensitive issue. So sometimes that I guess some people do not talk about. But talking about it here, and we have Dr. in the house. He's virtually on this conversation, and so he has been doing a lot of explaining when it comes to the just of what is, right? We say sexual dysfunction, and for us to have these conversations because I'm just going to go back to the report from 2017 where where I mentioned a certain Don about, how prevalently in this part of the world, and how some of us just find ourselves, unfortunately, in this situation. And then what then happens is that people end, having so many problems, right? Either the man is feeling left out or the woman is feeling left out. And before you know what's happening, it starts to spiral into something else. And it's spiraling into something else, and you're trying to find out an issue, and they can't even explain. That's why I say it's such a sensitive issue sometimes that people don't even like to talk about it. And then when they get to talking about it, it's like they're very squeamish about the conversations. No. Sometimes it's good to break these things out. Break it down. Let's understand what the problem really is. Break it down. Let's really be able to trace what the issue is in that home. And a lot of the time, when you're not having issues around communication or some of the other key elements that, Coach Mizi and I like to get into on the couch on Tuesdays, it comes down to this. Is it shocking when I tell you that it comes down to this? Well, know that it does come down to this. The Don who I was talking about, a professor of biochemistry, Musa Yaku, was speaking of this, and he said about 97% of marital issues in Nigeria were as a result of sexual dysfunction or bedroom inadequacies, as he called it, in men and women. And because we don't take time to understand how our bodies work, whether by virtue of what we're putting in or what we're giving out, then we end up having these issues, and you just can't seem to find a way around it. So that is it, and that's why we're having these conversations today. It is a series on body and soul called Sexual and Reproductive Health. It is on sexual and reproductive health, and Dr. Magnus is with us, taking on the conversation from the point self-dysfunction, where we're on this conversation. Feel free, if you need clarification, if we're speaking to doctor, if you can call it that, speaking to medical, feel free to call us in on the phone lines or send messages on WhatsApp, ask your questions. If it's still a little too sensitive for you, you can be anonymous. Okay, we'll attend to them. Just make sure that you are joining in on the conversation. It's so important that you do that, okay? So, Dr. Magnus, let me be sure that Dr. Magnus is still with us. Let me just make sure that he's with us. Oh, yes, he is with us. Dr. Felix, can you hear me? Dr. Felix, can you hear me, sir?
I'm hearing you.
All right.
Very well.
Okay, fantastic. So let's get back into the conversation. Phone is ringing. Could this be a question? Ready? I don't know. Please make sure the conversation, okay? Hello?
Hello.
Yes?
Hello?
John? Yes, go ahead.
So if I if I use to manufacture something like that. So sorry. And secondly, I want to ask a question.
Okay.
Hello, am I here?
Yes, go ahead.
Talking about these cases, as the doctor started, he mentioned some cases. Although those ones that he mentioned, I experienced it also. I do experience it from the beginning. That is a starting point. And also, I want to ask you, being a guy, and you have a person you have never accessed before, a guy you have never accessed it, is there any disadvantage about it?
All right, I get your question, John. Let's let the doctor get in on the conversation. All right, thank you. All right, Dr. Felix, the caller there said, first and foremost, we're using some big grammar. He says we should break it down. We should make it easier for him to understand. And so we're going to have to work on that. I think as these episodes progress, I'm hoping that we can get to the point where a lot of you can join in on the streams, because the doctors at some point will be using props to show you the part of the bodies that they're talking about. I'm hoping that we can get to that in subsequent episodes. So in case maybe the word is big and you wanted to break it down, by the time you're looking at the model of what he's talking about, then it becomes a little easier for you to understand. But for now, doctor, he says, please let's keep the terms simpler. And then secondly, he says, it's a question there. Perhaps you can address it in the course of the conversation, or wait till we're done so that we don't get you off your train of thought, whichever works for you. The question is, for somebody who hasn't had sex before and is experiencing some of these symptoms, should he be worried? For somebody who hasn't had sex before, can he possibly have sexual dysfunctions? when he hasn't had sex? Because some of the symptoms you explained or signs you explained, he says he experienced them. Let's go.
Okay. So let me just make a quick response to that.
Okay.
Yeah, just like we said, sexual dysfunction could be psychological, meaning that it could be due to, your mindset, the way you think. It could also be due to specific disease process. Yes. I think a better way to put this question is the fact that those who have not had sex before can actually have sexual dysfunction, but we can't make a diagnosis of sexual dysfunction until someone begins to engage in sexual activity. What am I saying? For instance, somebody can have a low testosterone level when we check the blood. Meaning that if he goes, submits his blood sample and we check, the testosterone can be very low. That may suggest that this person has a sexual dysfunction. But we can't make that diagnosis until the person tries to engage in sexual activity and maybe there's no desire, there's no libido. I don't know if you're getting. For instance, somebody who, does not have maybe any form of desire for sex. Yes, because maybe you're not married, you've never really bothered having any form of sexual activity. Somebody may suspect that, yes, the possibility is that this one may have what they call hypoactive sexual desire disorder. But we cannot make that diagnosis until you try to engage in sex and maybe you see that despite adequate stimulation, because it's what we call adequate stimulation, mean that, you're stimulated, appropriately and you're not able to engage in sexual activity, the desire is not coming up. Maybe either because now you have your own partner, which you didn't have before now. Because some of the reasons why people don't have desire may be due to the fact that they are stressed up. For instance, somebody who is stressed up and the mind is occupied with other things, like you're trying to make some money or you lost a loved one. So these things in themselves can occupy your mind, and in that case, your desire may be low. Okay? Yes, that means that most likely, you may not have any specific disease process at that time. It may just be due to, the change of events. That's why you're not having this. But the only way we can make the diagnosis is when you've tried to engage in sexual activity and you're not able to rise up to the challenge. Yeah. Because one of the things we know, even when we see our patients, is the fact that the mind is first the primary sex organ. Okay. When we say primary sex organ, I mean the mind is actually where sex carries out before the genitals now executes it. Most of the things we do in sexual activity is first from the mind. It's first from the mind, yes. And I'm sure as we discuss along the line, we'll understand why we said that. Because there are some cases where that I don't like having sex with someone who maybe is my wife or my partner, but I see that when I'm watching movies and I see certain erotic scenes, I'm aroused. But before this person, I'm not just feeling like anything is happening. So it tells you that it's the mind.
It is the mind.
So these are some of the things, yes.
Okay.
These are some of the things, yeah.
All right, let's talk causes. Let's talk the things that can lead to this. Because, just going from your statement about the mind and how, I think Dr. Habila last week was saying it's the biggest sex organ. I believe I heard him say that last week. And you're also, sort of like corroborating that fact. If we were to do assessment largely, I see that there's some common causes, but let's look at some in particular. I've seen that stress can be a major cause of sexual dysfunction. Is that true? Because, we have instances where, it has, before you joined, we're talking about how the Don who was speaking earlier on, a professor of biochemistry or so, was saying, 97% of marriage issues are as a result of sexual dysfunction in people. And so you have situations where the man comes back and is like, I'm not in the mood, I'm stressed. The woman comes back and she says she's stressed. And we hear that a lot. Is stress, how I see that stress is a cause here. Kindly corroborate that. And then secondly, how much of a factor can it be to affecting people to the point that it's dysfunction, as opposed to just being thrown around by using it as is an excuse. So you don't want me to own my property, but you don't want me to enjoy my property, as some people like to say it. So let's talk about stress as a cause. Yes, and to what extent?
Yeah, just like you said, stress is a very important factor when it comes to any form of intimacy. Intimacy, in this case, we're talking about sexual intimacy. Yes, because, one of the key things, just like we said, the first phase of the sexual response cycle is excitement. And it takes someone who is much awake, who is not feeling sleepy, who has the energy, who is willing and very much, interested, in quotes, to be able to get excited. If somebody is already stressed out from work, you're very tired, maybe the first thing on your mind may be just to get some rest. So that means that initial phase where you may need to play what we call foreplay you may not really be participatory. It may just be one-sided. Many times, what makes it pleasurable is the fact that both parties, are bringing their own supply, meaning that, as the man, you're trying to play around with your woman, while the woman is also trying to play around with you at the same time. That is what creates that excitement. That is what makes you to be more interested in the activity that is taking place. But a situation where somebody is so stressed out and you're more or less like a log of wood because you just want to rest, it becomes one-sided, and in that case, the excitement may not really be so much. So that's why stress is very important, in this case. And a lot of things can stress someone. It may not just be work. It may also be the fact that investments or money is not coming in at the right time.
It may be the partner themselves stressing them. Yes?
Yeah, of course, it can happen. In fact, there's this, I'm sure, for those who are on media, someone was praying, one of the partners was praying that, Lord, remove all the stressors from my spouse. And suddenly, the answers deeply.
This partner disappeared.
Yeah, so these are the issues. So I was saying that, stress could be so many things, yes, but very important. It's very important. Yeah.
All right. There's another cause that I'm seeing here. I'd like us to get into. To some extent, is it to say we get stress to psychological issues?
Yes.
Okay.
Correct.
Okay, that's fine.
Psychological.
Okay. So let's
the same.
Okay, go ahead.
Sorry, I was just trying to add, for the same activity or for the same issues that will stress Mr. A, Mr. B may not be stressed. For instance, Mr. A may have a nagging partner and is so stressed up because he or she cannot endure or cope with the nagging. While Mr. B, over time, may have built some capacity to endure such, maybe know how to, when the person is nagging, know how to pump the thing, be able to talk to the person. In short, if the thing comes down, you don't take it so personal. You try to track yourself from the emotions that is happening. Yes. So, meaning that stress, to some extent is relative. That's what we're trying to say.
Okay.
Yes.
I'm curious, before I move on to the next cause, I'm curious, being a doctor, especially urology, you see patients that come with complaints about dysfunctions, yes?
Yes, I see a lot of them.
I'm just curious. I want to know how you're able to diagnose, for example, if somebody's going through. Have you been able to diagnose in the course of your practice that the stressor is their partner, and what recommendation did you make in such an instance? Dr. Felix, are you there? Can you hear me? Did you hear me? Hello? Okay. Did my question scare the network into... Okay, let's see if we can get Dr. Felix back. Are you there, sir? Can you hear me? I think you're muted. This question, very important question. And then you'll mute, sir. Come back to Felix. I can see that I had to unmute your mic so that we can get. While Dr. Felix is trying to come back on, some questions here. Joseph from Mutako. Okay. Interesting. Okay. this question, I think I better read it out when Dr. Felix is here, so I don't have to repeat it again. Dr. Felix, are you back? Okay, I can see
I'm
you're
back.
muted
I'm
now.
back.
All right. I was asking a question.
Sorry for that.
Oh, it's fine. Network,
Thank
we
you.
know. Okay, very quickly. A question from the question for you. I said in the course of your practice, when people...
It has gone off. The battery is low.
Your battery is not low in Jesus' name. Battery cannot be low while we're having this conversation. It is not now. Verify that you're with me, Doctor, please. Okay. And the network is not networking. Okay. I will come back to, or rather, I believe Dr. Felix will connect with me once he's able to sort out the issues at his end. Let's see. Okay. All right, I'm messages, and I will get to them. I see one here from somebody who didn't put his name, and he says, who is a younger or an older man? Are you asking for an age range? I need to be sure that we understand your question clearly. We understand your question clearly. Let's see. Come to Facebook here. Let's see what the messages are saying. Judwell Chukuji, just joining. What did I miss? I don't think you missed much. I mean, depending. I mean, you could have missed much. I don't know. But let's try and get Dr. Felix on so that we can get into this meatier part of the conversation. Perhaps if you're able to stay on at that, you wouldn't have missed as much. See, we network issues getting Dr. Felix back on. So perhaps we'll see about I'll give you one more shot. Dr. Felix, are you still there?
Yes, I'm here.
Okay.
Sorry.
How is the network at your end now? Is the battery okay now? I caught that one when you said the battery is low. And I was praying in Jesus' name that your battery should not be low.
Yeah.
Okay. So we're good now.
You are good.
Okay, because I have a ton of questions here for you. Starting with my own. In the course of your diagnosing patients that come in with complaints about a sexual disorder, I've said in the instances where you notice that the stressor is their partner, I'm curious to know how you prescribe help to them in those instances where the stressor themselves is their partner. I'd like to hear that, please.
Okay, thank you very much for that good question, because it's a very common question we face every day when we see people come. Yes, of course, stressors are handled similarly, whether it's from the partner or from someone else. Usually what we do is called psychotherapy. Don't worry about the big, I'm going to explain.
Okay.
Like I said, it's more about the mind. I gave an example of Mr. A and B. Trust Mr. A may not trust Mr. B, but Mr. B may have built some form of capacity to understand the partner in such a way that, even that situation like the nagging becomes a turning point for some form of comic relief and play that may even cause them to become excited together and end up having a wonderful sex experience. Why Mr. A takes it so personal and tries to put his emotions into whatever the partner is saying, and becomes a lot of stress. So in psychotherapy, what we do is that we try to hear them out. Sometimes you may have to involve the partner, mean that both of them should come, you counsel them together, telling them how, maybe this one needs to, calm down in the naggings and all the other things they are doing. Then also, while you educate the other person not to be too emotional or take certain things personal, because sometimes, for instance, men are not as, women to some extent may be a little more emotional. They want to express so many things. But as a man, it's not everything the woman says that you should pay attention to in terms of, always wanting to repeat after her or for the same token she's bringing. Sometimes you just understand that she's just maybe trying to express herself. It's for you to see the good side of this discussion and take it up and, set the tone of what happens afterwards. So we try to educate them.
Okay.
Educate them, make them understand that, this thing you're calling stress is not necessarily stress, because, it can actually be a turning point for even a greater fun.
Okay.
So we call those processes psychotherapy, So it involves a lot of things. It also depends on, what they say, the presentation, and so many other factors. But usually, it's not like we prescribe specific medications for that. Of course, there are supportive medications we also give, because sometimes, psychotherapy alone may not be enough. Yes, you've talked to this person, you've educated the person, but we know that this thing is of the mind. So sometimes,
you have to help the mind along.
Sorry?
You have to help the mind along.
Yes.
With the support of
because
medication.
for instance now, okay, this person can't just have an erection because in as much as you've told this person that, don't put your emotions into what your partner is saying, but already, it has already affected this person in such a way that erection is no longer coming up. So you may need to give some supportive medication to, bypass, the normal, process and help this person have an erection in the midst of, this recovery process, so to say. And when the person can have an erection, and a good erection at that, it may even help to put like a stop in the nagging, because sometimes why people nag may even be because they're
lack of satisfaction. Yes,
they're not getting satisfaction. So if you give some supportive medication and this person can, give this person a wonderful experience, the naggings may just eventually end. So we give supportive medications at the same time, as psychotherapy most of the time, so as to help everybody to perform their responsibilities.
All right, let me get to the questions and the comments coming in here on Facebook. Just because our live stream will soon end, let me quickly get there. So this person says, at 35, I still masturbate. I started in my SS2 days. I met a lady, she was my classmate, but because of our closeness, not dating, we had sex like every day. Any day I go to her house, we must have sex. But she never missed her period one day. I was just thinking to myself, what is going on? Is this a dysfunction? Then I was 29. She was 37. Is that a problem in the future as I intend to get married? So the layers to this question here. First and foremost, after this masturbation in his SS2, he's still doing it at 35 years of age. Layer. On the other layer is the experienced lady who he was very, very active with sexually, and she never missed her period. And I guess he had him thinking, shouldn't she have gotten pregnant by now? And then he's now saying, is there a problem? Is that going to be a problem in the future? I think the hyperactivity with the sex is because I want to get married. And I guess that thing about her not taking in scared him, if I'm understanding this question very well. Do I go ahead and ask all the questions, Doctor, or do you want to attend to them one at a time?
Okay, I think let's take the question one at a time. Okay, so let's talk about the masturbation, that he's been masturbating, for a while now. If that is going to affect his sexual function, right? That's what he's asking.
Like I said, there are two layers.
Yes.
The long-term masturbation, and then the fact that he was very active with a lady for a number of years and she never got pregnant.
Okay, yes. First, maybe let's start from the last one.
Okay.
Pregnancy involves two people. One person cannot just be pregnant, meaning that a guy cannot just become pregnant. You need a woman. Just like a woman cannot just become pregnant, you need a man.
I'm so sorry, Doctor. I have to stop you right there. Did you say a guy do guys get pregnant?
Of course, guys get pregnant by impregnating a woman. That's what I'm saying.
Thank you.
Course,
I needed clarification.
They don't carry pregnancy,
okay, thank you.
They have the capacity to introduce.
Okay, thank you for clarifying. People are doctors sometimes. When you say these things, you think it's normal. To us, we don't understand it like that. So thank you for clarifying. Go ahead.
Yes,
okay.
Yes, that's what we're saying. We're saying that it takes two people to actually achieve pregnancy. Mm-hmm. So meaning that even if a man comes into our consulting room and says, I've been married and I don't have a child up till now, we still take it as inability to achieve pregnancy. It's not like the man carries pregnancy, but we're saying that the person has not been able to impregnate somebody.
Okay.
That's what we're saying. Okay. So, and for this one that has been, of course, having a series of pregnancy with this lady, hoping to...
Series of sexual activities.
Yes, yes, intimacy and stuff, and hoping to impregnate her, and it's not happening. Well, there are many factors here, because not every sexual intercourse must result in pregnancy. There are chances of pregnancy for every cycle of a lady, so to say. That is one. The other thing is that the person in question needs to also be sure that he's normal. The lady also needs to be sure that she's normal, because if there is an abnormality in one person, in which case, if the man is not able to fertilize a woman, that is what we call infertility on the part of the man. Meaning that you can't impregnate somebody, either maybe because of low sperm count or, there's no sperm at all. Because there's something we need to understand. the fact that somebody after intimacy, comes, what we call comes, maybe after orgasm release, doesn't mean there must be sperm in that emission. What comes out is called seminal fluid. And sperm usually constitutes just like about 5 to 10% of the entire volume. And sperm is what is needed for pregnancy. So it means that somebody can have large volumes of fluid, seminal fluid coming out after intercourse, but the sperm cells in it are either too low or even absent.
So question.
Maybe.
Sorry. So quick question. On that, is that a sexual issue? Is that fertility issue? Reproductive health?
Yes, saying I was even about going there that it's actually beyond the scope of this particular discussion. Because it's more or less reproductive. Yes, because it's sexual dysfunction per se. Rather, the sexual dysfunction, here is maybe in relation to the masturbation he talked about. It will affect him in one way or the other. Yeah, masturbation to some extent, yes, some psychological impact on the person. Yes, generally in most medical books or in medicine, we don't consider masturbation to be, in fact, it's considered to be a healthy habit, in quotes. However, I'm saying that over time, psychologically, quite a number of persons can become affected by the fact that they've been used to this act of masturbating, so that when they now meet a life partner, somebody who has, in some idiosyncrasies, not just like those, in fact, that they can easily just handle their organ and begin to stimulate themselves immediately. Maybe now you now meet somebody who, maybe by the time you want to just meet her, she tells you that she's hungry, she needs to eat shawarma, or she tells you that she's stressed up. So that can easily kill your libido and desire. And eventually you begin to have sexual dysfunction because you've been used to just getting it immediately. And that is not the way the real intimate activity happens. Because you need to consider the mood, you need to consider the state and the desire of the next partner.
All right, Doc. Sorry, quick break. We'll be right back.
Your party when it reach time to relax and enjoy. Make you wake up your taste buds with every sip of teasers. Whether you deal with friends after exercise, or be you just the chill. Teasers now your party. Better taste and rich goodness. Gidigba for your enjoyment. Grab teasers today and enjoy good times. Make you drink responsibly. Teasers now don't reach a year and above. Teasers the fun, no?
All right, and we are back. I said it was a quick one, and I meant it. All right, Doctor, sorry to interrupt your train of thought there, but I think you've safe to say that we've answered that question, right? You said chronic masturbation can be a problem, yes, long term. Okay, but it in itself is not a sexual dysfunction.
Yeah, it in itself is not a sexual dysfunction.
Okay, all right.
It in itself is not one of the sexual dysfunction that is described. It's just that over time it can result in a form of sexual dysfunction, in which case, because you have been used to this act of, masturbating whenever you want it. But now you now have a real partner who does not give you that room immediately to just grab her. Just like you can yourself and begin to date with whatever you want. That can put a form of, it can put a challenge to you. In which case you may have performance anxiety, which will eventually result in a form of psychological sexual dysfunction. It can also put some form of problems in your desire, because you don't know if the way you're desiring to do this person also has the same. I'm saying that chronic masturbation affects your psychology. That's what I'm saying.
And this is both male and female.
Psychology. Yes, male and female, yes.
Okay.
Both parties.
All right.
Eventually can affect your psychology.
All right, then.
And also we need to know that generally there's no sexual intercourse between any two persons that are the same. Meaning that, because, that there's certain things, a lot of people, talk about, which, sometimes go to throw a little. People will tell you that why I'm having, I'm doing this, I'm doing that, is because I'm trying to learn the art, so I'll get more experience. But sometimes we notice that, you can't really gain as much experience. Rather, you begin to have experience with, the person you have decided to engage in, because every individual is so different in terms of sex. And it's also why some things have, desire, erection, or rather will not be aroused with a particular partner, but with another partner they are aroused. Okay. So maybe that you need to do as much so that you can become used to always getting aroused. You have to, for every person there is always you coming to that phase of desire, plateau, orgasms, and I mean, it's so different for individuals. That's what we're saying.
Let me try and see if I can simplify what you have just said. In essence, practice, as long as it's not with the same person every time, does not make perfect.
Doesn't make perfect, yes.
Okay.
Doesn't.
Okay. As long as it's not with the same person. All right, let's quickly do this. The stream is about to end, but the conversation will continue on air. But I just need to attend to the messages on Facebook so that when the stream ends, we don't lose out on that. Noyewo Koma asks, who is a younger or older man? When we're talking about age-wise, I think this question has to do with the myth or fact segment where we're saying, as you get older, your sex drive wanes. So he's asking in terms of age, right? Who is a younger man, or up to what age are they considered younger, and at what age are they will they start to be considered as older men?
Okay, let me get that. You mean at what age will you consider that someone is older?
Yes, so we're talking about sexual virility, right? Because yes. On the myth and fact segment, he said, is it true that as you get older, your sex drive begins to wane? So as far as sexual virility is concerned, at what age can it be said that your virility will start to wane, so to speak? Because then you are considered older. And then from what age to what age are you seen as the emperor, the conqueror, the champion, the lion, as far as sex drive is concerned?
Okay, well, generally for most persons, the age is not very specific per se, because just like we said, it begins to decline doesn't mean, you don't have sexual drive, you can't engage in sexual activity, but we say it begins to decline. And I already said that if you look at it, some literatures have put it that most men are at their peak between the ages of 18 to 25. But we know that a lot of men, even at that age, may not have even done much in terms of sexual activity. In fact, some will not be married at that time. Mm-hmm. But we say that this is their peak. But generally, testosterone, which is the male hormone that, mediates libido, desire, and frequency of sex, begins to decline in terms of the values begins to fall when you check it. Like if you check it in the lab, it begins to decline. Doesn't mean it goes below normal immediately from the age of 40.
From the age of 40.
These are just figures to guide, management as well as treatment of people who have problems.
Okay.
But suffice it to say that the exact value of some of these things does not necessarily correlate directly with the symptoms, does not necessarily correlate directly with what the person complains about. Some persons may even have values of testosterone, that's the male hormone, that is low, but they are still able to have desires, they are still able to engage in sexual intercourse. While some other persons may have, a borderline, meaning that it's not necessarily low, but it's just at the lower limit of normal. And they're not able to. So there are a lot of, it's not like it's clear cut. It's just something that begins to decline.
Okay.
Begins to decline, meaning that. But for everybody, it varies to some extent.
Okay. All right. Makes sense. Let's come to this question here. But this has to do with the female body. But my MC Genius is asking, he says, please, I want to know what causes pain during sexual intercourse. A lady told me she detests sex because she experiences pain. Most times, her sex organs need to be massaged with warm water thereafter. So he's asking what causes pain in sexual intercourse in a woman, because this is the woman's... a man is asking, but he's saying this has been his experience with a woman where it's so bad that you now need to massage her with warm water thereafter, her sexual organs. So what causes that pain?
Yes. Very, very important question. Just like we said when we were discussing initially, pain during sexual, or rather during intimacy, as the case may be, is a sexual dysfunction. It's not a normal thing. Sexual intercourse should be painless. It should be enjoyable and pleasurable. Yes, and there are many factors that could cause this pain. Just like we said, so for persons have this where the muscles of the genital, especially in a woman, tends to tighten, when they anticipate sexual intercourse and penetration. When they anticipate that somebody wants to penetrate. So, many times because of fear, so they have this unusual, tightening of the muscles around the place. Why that happens sometimes we may not be able to explain, but some other times, it may be due to, previous injuries during sex. Maybe they've been raped before or something like that. So already that trauma makes them, whenever they anticipate something like that, it's a protective response, meaning that they're trying to protect themselves.
Yeah.
So in that process, that makes them, their muscles, around that area begins to get narrow. Then also pain can be due to, it may not be that the person has any problem, it may just be the fact that, the male organ may be, the person may be well endowed, in which case, and the partner, which is a woman, may not be, as may still be, for instance, if it's a virgin, that the first time the person is having that, that can actually cause some form of, pain in the process, for some persons. Then other reasons why people may have pain, during this thing may be that the person is not so stimulated, meaning that the place is not lubricated. Remember I said one of the first phase of this response, when somebody wants to engage in sexual intercourse, is the fact that it becomes active for the woman. There's increased secretion, the genitals, and that increased secretion allows penetration to be, less painful and without much friction. So if that doesn't happen, it can actually increase the chance of pain during the process. So it also depends on the exact reason why it doesn't happen. But suffice it to say that whatever the cause, it is known as vaginismus. Usually if it's at the time of penetration and the pain is usually around the opening. But if it's deeper, if the person feels the pain inside, not just around the opening, we call it dyspareunia. But I think this person, should actually see a doctor who should look at these things properly and evaluate better. Yes, rather than just using hot water to always
to massage.
Massage. Yeah.
Okay. All right. Thank you for clearing that up. We have, say, 10 more minutes before we have to wrap up on the conversation today. So, and questions are starting in. So try and go through them a little faster. Someone is asking here, Joseph Amutako says, I noticed something with my penis. For example, if I don't have sex for like 2 or 3 weeks, my private part will become big or fat. Sometimes if I'm urinating, after urinating, I will release sperm at the same time. I'm so confused. What's the problem? Is it a please, I want to know. Over to you, Doc.
After urinating.
First and foremost, he says if he doesn't have sex for like 2 or 3 weeks, his private part becomes engorged. I'm believing is beyond big or fat because it has to be engorged for him to be releasing sperm while he's urinating or after he's urinating. So he's asking, what's the problem? Is this a medical issue? Is this a sexual dysfunction? Do I need to do something for him not having sex in 2-3 weeks and his penis is becoming fat, large, engorged, whichever one?
Okay, I want to believe this engorgement he's talking about means maybe he feels like maybe he feels aroused or something. Maybe possibly.
So it's not clear. It's not clear. He just says it's big or fat.
Yes, he just gets engorged.
But after urinating, he releases sperm.
He releases sperm. Yes, that's what I'm saying. The tube, what we call the urethra, through which urine comes out from, the same tube through which sperm comes out from, and there's a connection there. So sometimes. Sperm coming out during urination could be a form of sexual dysfunction. Could be. I didn't say it is. Could be.
Okay.
Yes, and that is why sometimes it is not very easy to put answers to questions like this just on this kind of show. It may require some detailed evaluation to know exactly what is happening. But there's also what we call wet dream, in which case, sometimes, people just release sperm and it's not as though there's any problem. It's just a case of, the body trying to, clear itself off.
No, but he was very specific as to what leads to it. He says it's when he's not sexually active for 2 to 3 weeks.
Yes. That's what I'm saying. That possibly if, when he's not sexually active, maybe he gets excited and he never, he didn't engage in any form of sexual intercourse, meaning that sperm would have also, been produced, or rather semen would have, accumulated around that area. So sometimes it can trickle out.
Okay.
What happens in wet dreams? People sleep, especially during puberty, because of all the activities of the day, they have a lot of dreams and makes, semen to, when they wake up in the morning, they see a lot of now staining their underwear. So I think possibly because this person has been sexually active and when he doesn't engage in sexual intercourse, possibly the person was also excited at some points. There's some release and accumulation which eventually comes out. But just like I also said, when it also comes out during urination or after urination, it could suggest dysfunction or retro.
Okay. All right. Let's get Doc back on to take on the next 5 minutes before this segment ends for today. We typically end the conversation around 11:15. We're going to try and push it because the questions just keep pouring in, but we may not be able to take all of them. All right, I will have a lot to get to. So let's just go in very quickly and then we will wrap it up. Right. I see a comment here. This one from Franklin from New Year. He says, hello, Somi, first time texter. Nice pick you brought up. This is, thank you for your message. I appreciate that. I get the doctor back on so we can conclude. And that will be it for the night. Okay. Right, back on any second now, but just before he does that, let's quickly just quickly mention that we will have this conversation next Thursday, as that we haven't touched. I mean, I think we started to take on right after defining what sexual dysfunction is. We're able to address maybe one cause, which is the stress, psychological cause. And so we will have to come back. So just in case I don't take your questions today, do not be offended. We will have to come back next week and continue. This is a series, right? The series on sexual and reproductive health. So we're going to be doing it for a number of weeks before we move on to another conversation around, your health and your lifestyle. But Dr. Felix is here. Apologies for that abrupt cutting off, sir. Let me just give you the last question, and then you answer it up and then bring it to a close, if you don't mind. All right, so let's do this. Okay, this is a comment. Let me read this comment. It says, Doctor, medically I agree with you, but I can still tell you that grace and genes differ. In Yoruba land, where our old man was eating good bitter leaf without this our generation seasoning that kept men in action, those men performed till their 80s. I have witnessed one of my uncles, a big dad, then in 65 years old, still fire bullets, and the wife will run out shouting, don't kill me. One day the two of them ran out naked. Baba later took a young lady to keep firing with many children. He went to join the older last year as at the age of 95. Doctor, I believe in medicals, but I so much believe in what we consume and the genes to perform well. So me, with this beautiful talk, I want to be firing until 100 years old with the only one wife of my life. Amen. Sexual dysfunction can also be caused by economic situations in a nation. Wahala deo. This Yoruba, I don't know that I can read it, but I will try. Ki Olorun bawa. Okay, no, let me leave it so that I don't go and say what is not my business to say. Dr. Felix, your thoughts on that, and then you wrap up the thoughts you were on before the disconnection, and then we bring it to a close for today and take on the rest of the questions next week, please.
Sorry, I didn't get that clearly. Maybe you could just be a little louder, maybe.
Can you hear me now?
Yeah, better, but maybe just a little louder. Yeah.
Okay, I can do that. There was a comment basically alluding to the fact that it doesn't necessarily mean that as you age, your sexual drive will decline. He was telling a story about an uncle of his who was 65 years old, who was still firing, and the wife couldn't handle it, to the extent that he had to take a younger woman to keep up with his sexual virility. And he says he also wants to continue to fire till he's 100 years old. He said it's largely down to grace genes and also what you consume. Because he said back then, they ate more organic, I believe. I'm paraphrasing, but not like we have it today. So that point is what he was making there. I'm saying if you could give us your thoughts on that, and also let's wrap up the conversation for today.
Okay, that's fine. Yes, well, just like he said, we said begins to decline, but at the same time, I try to make it clear that it varies from people, meaning that, it doesn't mean everybody who is 70 years cannot engage in sexual activity. But we're saying that I'm sure this uncle of his will not be as active or will not have the same sexual prowess he used to have when he was maybe 25, 30, as opposed to now he's 65. Yes, so these are the things we are saying. Declines means for every individual, it keeps declining with age. Doesn't mean you won't be sexually active. There are people who are 100 years old and are still sexually active, and but they will also tell you that they are not as powerful or very, very much active the way they used to be when they were a little younger. These are what we're saying. So it varies from from individuals. Also just like he said, certain people tend to be more viral in terms of in their sex life compared to other persons.
Okay.
So these are the things. Yeah. So just like I was saying, sexual dysfunction in a nutshell is any problem occurring in any part of that sexual response cycle that prevents you from having a pleasurable sexual experience, that doesn't allow sexual activities to be satisfactory. That is sexual dysfunction. It could range from both psychological problems as well as specific disease conditions. Psychological problems in form of stress, economic situations, loss of a loved ones, partner-related, performance anxiety, and many other things that, we don't need to mention. Then also specific disease conditions such as chronic diseases. One of the commonest things that most people don't even appreciate is that hypertension, high blood pressure, high BP, as most people will call it, causes a lot of sexual dysfunction. In fact, it is said that a man who is having weak erection, and is due to a cardiovascular cause, usually will be having a cardiac arrest 2 to 3 years down the line. Meaning that if the weak erection is due to a heart-related condition which the person is not aware of, 2 to 3 years down the line, if nothing is done, the person will have a cardiac arrest. So it tells you that high BP and all the heart-related problems are so important when we talk about sexual dysfunction. That is why one of the things we do when somebody comes with that complaint is I want to also check your heart.
Okay.
We don't just only go and focus on the genitals. We check your heart. Diabetes or blood sugar problems, they all contribute to some form of sexual dysfunction because they block the blood vessels and prevent blood flow to the organs. Not to talk about other forms of chronic diseases, kidney conditions, and several, even infections, recurrent infections and all kinds of things. They can contribute to some form of sexual dysfunction. Yeah.
All right, Doc.
So I think the summary is that it's good to see a specialist when any of such comes up.
Okay, so here's what we're going to do. We're not going to rush through some of those other causes, okay? We're not going to rush through them because we're having this conversation so that we can help people get better about themselves. So when we're saying, other causes of sexual dysfunction, and we're mentioning heart diseases, and we say other medical conditions, we want to get into those medical conditions, at least list them out to a certain extent so that people are listening and thinking, okay, do I have this? And is it adding to am I having issues when it comes to sex and all that? So we will not rush through that. I've said to the people that we will do at least one more on sexual dysfunction. We'll do one more week on sexual dysfunction because we need to address the causes and we also need to get to the many questions that people have to ask, okay? So I see you. Someone sent in a message earlier on asking about the symptoms and the consequences of is hypoactive sexual disorder. Did you mean hyper? So we have loads of questions to get to here. So doctor, if you just please be kind enough to join us again next week. And we didn't dwell a lot on women's experiences. I think there was just one on pain, right? We would like to delve a little bit deeper into that. So let's continue this conversation next week. Yes?
That's fine.
All right then.
That's fine. I'll be very glad to do that.
And we will be very glad to if we can see some props, Doc. I know I'm saying this like I'm saying it live on air, but I know we also have this conversation off air. So that, sometimes people just need to be able to see and understand. So there was a word you used when you talked about what was it? The sexual organ in a woman. I think you mentioned something about the clitoris or something. If you have props that allow people to see, because sometimes these things are just medical jargon to some people.
Much for the media? Because some of these things, I don't know.
No, there are some props that we can use. A lot of us did biology, yes? There are some props that we can use that are not too every single detail, but helps better understand. Because again, there's that call for simplicity when it comes to explaining some of the terms. So we'll keep it PG as much as we can keep it PG. But at the same time, these conversations need to be had. So thank you so much, Dr. Felix Magnus, for coming to do this. We appreciate you and we look forward to having you on again next week.
Thank you. I appreciate you too.
Thank
you, everyone.
All right. Thank you, sir. And that's it on Body and Soul today. I see your comment, Locomotion. Appreciate you too. He says everything went well. Thank you so much. This person who was asking a question about something about spiritual wife. Is it a myth? We will address as much as we can address as far as this conversation is concerned, but we'll have to let it go for today and take it up again next week. Thank you so much, all of you, for being such a wonderful listening and participating audience. Body and Soul will be back on Thursday next week from 10 p.m. For now, we have to go on a quick break. When we come back, the late night request show will begin.